Hello, welcome to Chapter 20. In this set of video lectures, we'll be discussing coding congenital anomalies. We'll talk about what they are, we'll talk about how to code them, but let's start by talking about the foundational rules for coding congenital conditions. Okay, and again, this is coding congenital conditions, and this covers any type of malformation, deformation, chromosomal abnormalities, or any genetic disorders. So let's talk about what we're going to be covering here. Again, we're going to be talking about how we can recognize how these are organized, and we'll focus a lot on the special coding rules that apply to this chapter. Most importantly, we'll understand when and how these codes are used across the patient's lifetime. So you can see here how the chapter is organized. It's useful to keep this in mind as you're looking for these codes. Q00 through '07, of course, codes for congenital malformations involving the nervous system. Q10 through Q18, eye, ear, face, and neck. Q20 through 28, circulatory system, and so on. Again, we have congenital malformations of the genital organs, Q50 through 64, musculoskeletal system, Q65 through 79. We have other congenital malformations, Q80 through 89, and chromosomal abnormalities, Q90 through 99. And then genetic disorders not elsewhere classified fall into Q40. Important. Don't try to memorize every code. Focus on recognizing this body system first and use it to guide you in addition to following the things we've already learned how to do, such as looking up the main term in the alphabet and some of the other things we'll be taking a look at. So what exactly is congenital anomaly or chromosomal abnormality? A congenital anomaly is a malformation. It's an abnormality that's present at and existing from the time of birth. A chromosomal abnormality, on the other hand, involves an abnormal number of chromosomes or a structural abnormality of the chromosomes. And a lot of people use these terms interchangeably. They're really quite different. Important thing to bear in mind, congenital does not always mean hereditary. Some conditions are inherited, others are not. But if they're present at birth, they belong in this chapter. And again, these conditions are grouped into specific subcategories that identify the type of condition that's present and also identify the anatomic site. And sometimes they identify other specific variations of whatever the congenital anomaly is. And the more specific information the provider puts forth in the documentation, the more specific the code selection can be. Here are some very important things to keep in mind. I'd like you to pay attention to these slides. They contain high yield exam and real world rules. First rule, never code these on the maternal record. These congenital anomaly codes are only used on the infant or the patient's record. And then the second rule, which is very important, if a baby is born with the congenital anomaly, the first listed principal diagnosis code, if you will, in the hospital setting would be the Z38, newborn status. And then whatever the congenital anomaly is would then come second. And likewise, if the infant is transferred to another hospital, the principal diagnosis will become a congenital anomaly, right? it'll be that condition that is responsible after study for the baby being admitted to the second hospital. We would not underline code the newborn code again because you can only be a newborn once. And as we've seen before, these codes can be used throughout the lifetime of the patient. All right, so if a patient goes to a second hospital, once again, the Z38 would not apply. It would be whatever the code beginning with the letter Q is for that admission. And likewise, as we saw with other conditions, as long as the patient still has it and it's still something that is requiring valuation management, assessment, treatment, we're still going to code it throughout the lifetime of the patient. If the condition is corrected, there is a code for personal history of a corrected congenital malformation. That's a Z87.7. Some more important things. This is a chapter that has a lot of instructional notes, and you can see them here. Some examples include such things as spina bifida. Use the additional code for any associated paraplegia. Cleft lip and cleft palate. Use the additional code to identify any associated malformation of the nose. So really important, once again, to read the tabular as we've been talking about. And again, here's another example. Down syndrome, which is Q90. Additional codes may be required for any physical conditions or degree of intellectual disabilities that are present. We only want to code manifestations that are not inherent to the condition. Kind of goes back to that general guideline, right? So now we're going to pull all these rules together, right? And we can see that there are very chapter-specific guidelines for any of these conditions that fall into code categories Q00 through QA0. Any formation or chromosomal abnormality can be the principal diagnosis or the secondary diagnosis. If we don't have a single code that fully describes the condition, we would assign any additional codes for the manifestations. And normally these are called out in the tabular. We do not code inherent manifestations separately. It's kind of like that general coding guideline. We don't code signs and symptoms if they're inherently part of that process. And conditions may be diagnosed later in life, but if they're present at birth, these chapter 20 codes are still appropriate. And then finally, as we've talked about before, you can only be a newborn once. And if you're a newborn once, you get the Z38 category code for the newborn status if it's at the birth hospital. And that's all I have for you right now. Please come back and watch the next video lecture. We'll be covering coding by body system for these congenital anomalies. That's all I have for you. We'll see you in a few. Bye now.